Hi students, welcome to Pharma Syndrome YouTube channel. And today is our discussion on sympathomimetics. Sympathomimetics nothing but its classification. So I hope you know sympathomimetics are drugs nothing but they mimics the action of sympathetic neurotransmitter against the sympathetic nervous system. So what are the sympathetic neurotransmitter? The neurotransmitters like adrenaline, noradrenaline, dopamine, these are comes under the sympathetic neurotransmitter category. Okay, so these drugs mimics the actions of the sympathetic nervous system. So sympathetic nervous system, nothing but the sympathetic nervous system contains adrenergic receptor, alpha adrenergic receptor as well as beta adrenergic receptors. So both alpha as well as beta adrenergic receptors are belongs to G protein coupled receptors, and the sympathomimetics agonize mimics the action of this alpha beta receptors in the sympathetic nothing but adrenergic system. So here the first, a general classification of sympathomimetics. So for our understanding purpose, the general classification of sympathomimetics is these are direct acting drugs, these are mixed acting drugs. Just a second. So here direct acting drugs as well as mixed acting drugs as well as indirect acting drugs. Indirect acting drugs. So here regarding direct acting drugs means these drugs acts on the receptor. So here the drugs directly interacts with the receptor. It may be alpha receptor, it may be beta receptors. It is depend on the drug as well as its selectivity. And in this the drugs directing category, the drugs interacts with receptor. They may be selective category, they may be non-selective category. Next, in case of second category is mixed acting drugs. The example of mixed acting drugs like ephedrine as well as pseudoephedrine. So pseudoephedrine, ephedrine, both the stereochemistry is the difference. The difference between both are just stereochemistry. So what is mixed acting drugs? The mixed acting drugs having the action of direct interaction with receptor as well as they are also having the indirect action. So because of that, the category of drugs are called as mixed acting drugs. The examples like ephedrine as well as pseudoephedrine. Next category is indirect acting drugs. So here indirect acting drugs, these drugs does not directly interact with the receptors. These drugs does not directly interact with the receptors. These drugs initially increase the catecholamines, and after the increase in catecholamines, that catecholamines directly interact with the receptors. In case of direct acting drugs, they after entering into the body, they directly interact with the receptors. But in case of indirect acting, after entering into the body, first they increase the catecholamines like dopamine, noradrenaline, ephedrine, nothing but adrenaline in different ways. After that, that increased catecholamines binds to the receptors. So in this category of indirect acting drugs, there are four different categories. These four different category drugs ultimate action to increase the catecholamines, but in different ways. So we will see what are the different ways. First one is drugs increases release of catecholamines. The examples like amphetamine, which is a generally CNS stimulant, as well as tyramine. Tyramine is a chemically monoamine. It is generally present in the food substances like dairy products like milk, like cheese. So these two drugs increase the release of catecholamines from the presynapse. Next, uptake inhibitors. So uptake inhibitors nothing but once a neurotransmitter, for example here adrenaline. So once a neurotransmitter it's completed its action from the post synapse to again it go back to the presynapse for the storage purpose or for the termination of its action. Once neurotransmission action completed, it have to be terminated by using uptake. That is called as reuptake mechanism. So for the presynapse to post synapse, neurotransmitter will come to show its action. Once after its completion of action, again it will go back by using uptake mechanism. That is called as reuptake mechanism. So here the drugs like cocaine as well as tricyclic antidepressants. Tricyclic antidepressant generally used in the depression. So this cocaine as well as tricyclic antidepressants inhibit the uptake of catecholamines and increase the catecholamine levels at the postsynaptic receptors, nothing but target tissues. Next, monoamino oxidase inhibitor. So monoamino oxidases are the enzymes responsible for the catecholamines metabolism or catecholamines degradation. If the catecholamine degradation increases, catecholamine degradation decreases, then catecholamine levels are increases. So examples like salicylic as well as rasagelin, these are selectively blocks the monoamino oxidase B enzyme and prevent the metabolism of catecholamines, especially dopamine. Next, COMT inhibitor, catechol O-methyl transferase. Catechol O-methyl transferase. So when this enzyme is inhibited, catecholamines metabolism reduced. So because of inhibition of both monoamino oxidase as well as catechol O-methyl transferase, then catecholamines are unable to degrade, unable to metabolize, catecholamine levels are increasing. So here, as we know that indirect acting drugs, initially they increase the catecholamine levels in different ways. And after that, increased catecholamines interact with the receptors. So this is a general classification of sympathomimetics based on its action, direct acting, mixed acting, as well as indirect acting. The next classification is based on each receptor. So all these are sympathomimetics. All the sympathomimetics agonize the alpha as well as beta adrenergic receptors by acting on the sympathetic nervous system. Okay, the next is after general classification based on selectivity of the each receptor, based on selectivity of the each receptor. So we will go through that. So here this column is belong to the receptor, and here these are the selective agonist and these are the non-selective agonist. So first regarding alpha receptor, So for regarding alpha receptors and their locations, their function, you can go for our previous video on the adrenergic receptors. What is adrenergic receptors? How many types? Their locations, their functions. So here the alpha 1 receptors are generally present in the blood vessels. So the selective agonist on the alpha 1 receptors like phenylephrine, methoxamine, midodrine, and non-selective agonist on the alpha 1 receptors, nothing but alpha receptors like metaraminol as well as oxymetazoline as well as xylometazoline. So apart from alpha 1 receptor, they may also bind to the other receptors. That's why these are categorized under the non-selective agonist. Next, alpha 2 receptors. The examples of alpha 2 receptors like clonidine, selective alpha 2 receptors, clonidine. Alpha 2 receptors generally present in the presynaptic neurons of the central nervous system. The clonidine, methyl-dopa, dexmedetomidine, brimonidine. So clonidine, methyl-dopa generally for the antihypertensive purpose. Dexmedetomidine is a general anesthetic category. Brimonidine used in the glaucoma. And regarding non-selective category, apraclonidine having interaction with alpha 2 receptor, maybe it can also interact with alpha 1 receptor also, maybe other receptors. It comes under the category of non-selective category. So next, beta 1 receptor. I hope you know beta 1 receptors are located in the majorly myocardium. Apart from the myocardium, nothing but cardiac muscle, they also located on the juxtaglomerular apparatus of the kidney. So the selective agonist on the beta 1 receptors of myocardium like dobutamine, denopamine, xamoterol as well as prenolterol. So apart from these four drugs, dobutamine is commonly used in the clinical application to increase the heart activity, to promote the cardiac muscle contractions. Just a second. So after completion up to beta 1 receptors, next towards the beta 2 receptors. Next towards beta 2 receptors. Just a minute. Okay. So beta 2 receptor location in the on the lungs, that is bronchial smooth muscle. Lungs, that is bronchial smooth muscle. So here beta 2 receptor selective agonist like formoterol, solmeterol, solbutamol, terbutaline, as well as levalbuterol, which is also called as levosolbutamol. So the examples of selective beta 2 receptor agonist. Selective beta 2 receptor are used in the treatment of asthma. So these drugs causes relaxation of the bronchial smooth muscle and controls abnormal respiration in the asthmatic patient and feel free asthma from the patient. Nothing but gives feeling to the patient free from asthma. And non-selective drugs like ritodrin as well as isoxazoline. Okay, so this is the category of drugs acting on the beta-2 receptor, that is sympathomimetics on the beta-2 receptors. And next receptors are beta-3 receptors. So beta-3 receptors are generally present on the adipose tissue as well as urinary bladder also. Urinary bladder. So here the selective drugs acting on beta-3 receptors. So emibegron, mirabegron, solabegron. So all backgrounds, if you find any new drug with background, for example, tomorrow, rolabegron. So definitely it is beta-3 receptor agonist. And these all backgrounds like emibegron, mirabegron, solabegron, these three drugs selectively agonize the beta-3 receptors present on the urinary bladder. So this is a simple classification of sympathomimetics. I hope you enjoyed it. And regarding the application of sympathomimetics, you can watch our videos also. Thank you. Keep following our channel for more interesting concepts.